This is Greta Marie. She is a 1.5 year old miniature Schnauzer. She is my own personal dog. And she hasn't had her teeth brushed in a couple of months, maybe a couple weeks. She's got kind of smelly breath now. So this is what her teeth look like after not having been brushed. You can see there's buildup on those front teeth. That's all plaque, but if we don't get it, that's going to turn into tartar. And because she sleeps with me, she's got smelly breath, and I notice. So what we're going to do is we're going to use our long toothbrush for dogs, and we are going to put a little bit of brown Listerine. I just buy the cheap stuff, actually from Walmart, the Equate brand. It's just brown, and it's very, very not tasty to the dogs, but we're only going to use it on the gums. So hold this hair back. I start back here. Okay, and then I go in circles. I know, sorry, Greta. Okay, gently. And I'm using firm but gentle pressure. Okay, if these gums were much worse, they would bleed a little bit with that kind of pressure. You can see that's already a little bit better. Go in circles. That's firm but gentle pressure, and you can see there's a little bit of halitosis going on right there because it's creating some blood. But the Listerine is going to kill the bacteria that cause the smell. So a little bit of blood is okay, a lot of blood is not okay. So we're going to go in circles here. That's looking better, and I go both ways. Sorry, Greta. Try to get in between those little teeth because you want to make sure you get the gum line really, really well because that's where the smell is harbored. I know, it's just Brody, sorry. She sure is a good trooper. Okay, I'm going to check back here. And what I try not to do is go back and forth because I don't want to create a problem there, but little circles, and you can see if this gum line was worse. A little bit of blood's okay. So clean that toothbrush. Now we're going to do this back here. Circles. See, okay? Both ways. I want to get the bottom and the top. Okay, we got a little bit of tartar. You can see that yellow right there that the brushing won't get, so we need to use a scaler for that. And I'm going to make sure to double check all this plaque because it was so thick. And plaque on your own teeth would be super thick too. It'd start to grow mold if you didn't brush your teeth for 2 months at a time, so I'm kind of embarrassed about that. Sorry, Greta. No wonder you had smelly breath. Okay, I don't worry too much about the inside because I do a good job on the outside. And I don't want to make her swallow too much more Listerine, so I'm just going to work on scaling this now. You see, okay? This is our scaler. This is for dogs. I'm right-handed, so I'm just going to really gently keep the angle of my scaler the same direction as this tooth. And I'm just going to kind of go above that gum line and flick off this little bit of tartar. What a good girl, Greta. What a super good girl. And you can kind of feel it up there. It feels like little rocks, and it just pops right off if you get it, you know, early like I'm getting it now. Just like on your own teeth. A little bit of blood's okay. We want to get that tartar off. Just going to check this here. Yep, there's a little bit up there too. Very common on these Schnauzers, these are called piano teeth in here, to have the tartar get so thick and the gums get so bacteria filled that the tartar actually ends up holding their piano teeth in. So when they actually do go to the vet for a dental, their teeth have to fall out because there's nothing holding them in. So I try to pay special attention. My last Schnauzer had that happen and I was embarrassed that I didn't take better care. So I'm going to double check all these piano teeth. There's some nice tartar. I'm going to get above it, pull down. Just using enough pressure to flick that off. keeping your scaler flat on the tooth because you don't want to make grooves in the dog's tooth. You just want to get the tartar off. Good girl, Greta. Okay. I think that's enough for one day. They don't look too bad. They should smell a whole lot better. I am going to Listerine them again tomorrow and for the next 10 days on the gum line with a toothbrush, and that should take care of her breath. Thanks.